Welcome back to the channel. Okay, last we have dealt with some terms. We'll dealing with some other terms also today. Then we'll be starting the management part. Let's start. Ischemia reperfusion syndrome. Direct effect of tissue hypoxia and local activation of inflammation causes cellular and organ damage. हाइपोक्सिया और इन्फ्लेमेशन के कारण सेलुलर एंड ऑर्गन डैमेज होता है. The acid and potassium load that has built up can lead to direct myocardial depression, vascular dilatation, and further hypoxia. The cellular and humoral elements activated by the hypoxia and flushed back into the circulation, where they cause further endothelial injury to the organ such as lungs and kidney. These all leads to acute lung injury, acute renal injury, multiple organ failure and death. This पूरा जो ये फ्लो चार्ट है जो ये हो रहा है, दिस ऑल सीक्वेंस इज नोन एज इस्कीमिया रीपरफ्यूजन सिंड्रोम. ओके, एक बार टिश्यू हाइपोक्सिया हो गया, उसके बाद जो पोटेशियम और एसिड का लोड बढ़ रहा है उसकी वजह से वापस हाइपोक्सिया हो रहा है एंड देयर इज रीपरफ्यूजन. ओके, ड्यू टू हाइपोक्सिया it is flushed back into the circulation. So reperfusion. So this is known as ischemia reperfusion syndrome. Now what's the other term we are going to learn today? That is endpoint resuscitation. What is endpoint resuscitation? A patient resuscitated to restore central perfusion to the brain, lungs and kidney and continue to underperfuse the gut and muscle bed, rather than resuscitating until they have a normal pulse, BP and urine output. A patient resuscitated to restore central perfusion to the brain, lungs and kidneys and continue to underperfuse the gut and muscle bed. जो सेंट्रल परफ्यूजन को रेस्टोर कर लिया है बट इट कंटिन्यूज टू अंडर परफ्यूज द gut and muscle bed rather than resuscitating until they have normal pulse, BP and urine output. This is called endpoint of resuscitation. Now crush syndrome. It is a symptom complex in which a portion of the body becomes crushed due to heavy weight falls on the body and is kept for some times to crush all the tissues in that portion of the body. Example: earthquake, mine injuries, collapse of the building, etc. In this syndrome, diagemic shock occurs due to extravasation of blood into the muscle in the affected portion of the body. What happens in this? There is extravasation of blood into the muscle. Now, muscle become crushed and myohemoglobin enters the circulation and can cause acute renal tubular necrosis. Crushed muscles swell considerably, which leads to tension development between the fascia. Then circulation endangers and ischemic damage to the limbs, severe pain in the limb. In this syndrome, urine output decreases and patients show restlessness, apathy and mild delirium. Okay. Now, coming to treatment. Tourniquet to the affected limb above the crush injury. Parallel incision may be applied to relieve the tension through which crushed swollen muscle may protrude. Administration of IV fluid restricted to 500 ml plus urinary output. Low molecular weight dextran 40,000 or Rheuma Crodex is particularly effective. It maintains the circulation to kidney. 1 gram per kg weight of mannitol is introduced IV as 20% solution in 12 hours. Catheterization of the bladder should be performed before introducing the mannitol in the body. What do mannitol do? It restores the urinary output and prevent acute renal failure. Okay. Now, Blood transfusion is required after urinary output has brought to normal, and hemodialysis is used as a life-saving procedure. These are the treatment for crush syndrome. Okay, that's all for today class. We have dealt with all the terms related to shock. Now in next class we'll be starting with the management. Okay, till then, like, share, subscribe and comment. Bye.